Welcome, everyone, to the Bucks County Living Podcast. I'm your host, Alex Neff, your real estate resource. Today, I am joined by my good friend, Zoe Alloy, the clinical therapist and director of business relations at Lower Bucks Wellness. How's it going, Zoe? Good to see you.
It's going. It's good to see you.
You got that right. It is going for sure.
Yeah.
I'm really excited to dive into Lower Bucks Wellness and what you do in the community because you wear a couple different hats there.
Yeah.
And you do a lot of stuff behind the scenes to make sure that Lower Bucks Wellness continues to reach more people. And you also are very involved as a clinical therapist. So I'm really curious as to what Lower Bucks Wellness is and what kind of services do you provide?
Yeah. So basically, what we're a private practice. So we are women-owned, women-run, and we have psychiatric nurse practitioners, and we also have therapists. I believe 8. It's either 8 staff total or 8 therapists. 2 male therapists, and the rest are women. We do take children for therapy, ages 8 and up. And we take adolescents for medication management as well. We do a lot of things. That's just like the very basic. But we also have an urgent care for mental health. So we are the only place that does this. So Monday through Thursday, individuals could walk in between the hours of 10 and 2, and they will get assessed on the spot. And within 24 hours, they will be able to get a full psychiatric evaluation from one of our nurse practitioners.
Wow.
Yeah.
That's incredible because, you think of like urgent care and a lot of people go in there for like wound care or their a tummy ache or they're feeling a little under the weather. You never really think of like a mental health urgent care. People would, in my estimation, maybe just like go to a psych ward or a crisis center or something.
Yep.
So are you able to, because you don't, do you do like any inpatient stuff or anything like that, or more like refer to other places? How does that work?
So when an individual gets assessed, even if it's not through the urgent care, say it's like if I'm meeting with a client who, needs more support, we would refer to a higher level of care. So we have other providers that we're familiar with in the area where we're able to say like, somebody needs like inpatient treatment for mental health where we could give them a couple suggestions, or for IOP or PHP. Because with us, for therapy, typically individuals do like once a week. Bi-weekly is also an option, once a month. I'm someone that's just like, well, you hired me. So what do you want? Like, what are you looking for? Every therapist is really different when it comes to scheduling because it's really just about what's best for the client and what they're able to do.
Mm-hmm.
And then with medication management, it's like once a month follow-up visits typically. So with a higher level of care for somebody who needs more support, if they wanted to do like intensive outpatient somewhere, it would be like 3 times a week. Sometimes the individuals will step up to do therapy twice a week. And then if that's not enough, then it's like, okay, let's look into other options where you could get that extra support. So with urgent care, if we have somebody come in who would not be appropriate for just outpatient therapy and med management, we would be able to suggest to them other places to go. So it's not just like, hey, like, you're struggling and it's too much of a struggle for the kind of support we provide. Where we have places where we could recommend, and then there's a system where we'll call to check to see if they made it to where we suggested. Is there anything we could do further to assist and things like that?
And I think what I'm hearing is something so unique because it sounds like the approach that you and Lower Bucks Wellness takes towards client care is not like a one-size-fits-all approach. It sounds like each individual is cared for differently in the sense of we try to make the prognosis fit the treatment versus trying to make the treatment fit the prognosis, if you know what I mean.
Yep, that's exactly what we do. And we also like to think that's exactly what like sets us apart from other providers is we are person-centered. Like that's first and foremost. Like we cater to exactly what and who this person is, not their diagnosis, not, their gender, their beliefs, anything like that. It's literally looking at somebody as their own individual person that needs their own individualized care plan, that has their own experiences. Even if it's identical to somebody else's, their brain could process it completely differently. So we're very aware of everybody needs to be treated just like an individual. We never want to be looked at as a place that just, hands out a medication or uses a specific like therapeutic modality because that's what we should do, or that's what a textbook is, so this is what's best for people, because people are so different. So you can't just give everybody the same type of treatment and expect people to be okay when everybody's brain is different. So it needs to be looked at as such, for sure.
Exactly. And I try to have that same approach in my business with real estate, because people ask all the time, how's the real estate business? What do you think of this property, that property? And each property is so different and requires a different set of negotiations based on where the sellers or where the buyers are, a different set of contract, what depending on what state it's in. So each property is so different, and you really want to make the best informed decision for the clients, because at the end of the day, they're the people that are experiencing this next chapter or moving through this course in life. So I really love that Lower Bucks Wellness has that same philosophy, because it's so important, where it's client first, treatment second.
Yeah. We look at it as like, you hired us. This isn't like you have to be here and you have to do what we're telling you because it's the right way to go. It's like, no, we care about what you want. How do you feel about this medication? Like, what are your reservations? Like, how do you feel about your course of treatment so far? Your therapy, what's working for you? Because if something's not working, like, please tell me. I'm not going to take it personally. It's more of like, I want to work with you so you feel better. And if I'm not doing that, I need to know.
Exactly. We all have the same goal. Please just be as transparent as possible.
Yes. Yeah. Please.
Yeah, please. Are there any specific programs or treatments that set your wellness center apart from others?
Besides the urgent care, because we're the only place that does have a mental health urgent care that's fully operating and whatnot. We also have IV ketamine and intramuscular ketamine as well. We have a certified psychedelic therapist who is able to sit with clients undergoing these services and pretty much be there to support them and help them process what they're experiencing. Ketamine is used for treatment-resistant depression, PTSD, anxiety. It's used for trauma. And then we also have the nose spray, which is esketamine Spravato, what I know about this is, in medical terms, it hits a different molecule, I believe, like the S molecule, which is different than the IV and intramuscular ketamine. I could be wrong. I am not the best with the scientific parts of things. But with Spravato, the esketamine, we have that as well. That is a nose spray, and it has kind of a similar effect. That's strictly used to treat treatment-resistant depression as well as persistent suicidal thoughts. The IV and intramuscular ketamine is utilized to treat a wider variety of mental health disorders, which is why we recently brought that into the practice as well. So we're able to utilize those three forms of ketamine. Well, the third is esketamine, but we do that as well. We also offer groups. We have a postpartum group that's open year-round, so people could join at any time of the year, as well as a DBT group, which is dialectical behavioral therapy. It teaches people how to regulate their emotions, and that's an open group as well. And we also have ADHD and genetic testing. With ADHD testing, it's done on a computer. You come in for the test in person, and then your provider goes over the results with you at your next appointment. The genetic testing is very interesting, and basically what it is you take the test from home and you send it out, and your results let you know how you interact with medications and which medications might be best for you. And we also offer MAT maintenance treatment as well. We do Suboxone, Sublocade shot, naltrexone, Antabuse, Vivitrol as well. So we try to help a variety of populations that struggle with mental health.
Wow. Yeah, it sounds like you guys are doing a lot over there.
Yes, and we're also for future that also makes us a little different. We are in the process right now of planning and setting up holistic wellness retreats for people to go on locally for like a weekend. And we are also planning for equine therapy as well. Horses.
Oh, horses.
Yeah,
I was going to say equine. It sounds like equestrian. So horses.
horses.
Wow.
Horse therapy. Yep.
Do you, like riding the horses or
So
just taking care of the horses, or how does that work?
So I think it's kind of like a little bit of both where the horses are used in a therapeutic manner with clients. Our clinical director, Sarah, she is a big horse person and she's always wanted to do this. So she really knows the ins and outs of it. She's actually going to a barn like right now to visit, to meet with people there. And we're basically like at some of the barns, there's people that have a specific certification to work with horses in a therapeutic manner. And like she would come in as like the mental health professional as well. So I think what would happen is we'd work with staff at the barn and have our staff as well, like Sarah, have clients to assist with using the horses in a therapeutic manner to help clients like with trauma, PTSD, processing emotions, and things of that nature.
That's interesting.
Yeah.
Something a little less invasive.
Yeah.
Wow.
Yeah.
So you're doing a lot over there.
Yeah.
What's something that you as a clinical therapist have seen some of the best results in?
It's hard to say because I feel like, I mean, best results, it could be like somebody brushing their teeth for like a full week. You know what I mean? Like, or somebody, graduating college that had like debilitating anxiety. Like I feel like best results, there's so much that could encompass it. Like I've seen people have incredible results when they undergo ketamine treatments, I've seen people have incredible results just going through regular talk therapy. And I guess it really depends on people's like where they are in their struggles and like the mental health specifically that they're struggling with, because if somebody just has say like ADHD, and they're going to work but their life is like very disorganized and it's starting to make them like depressed and things like that, like I'm not off the bat like ketamine,
Right.
So but like best results for them could be setting up something, like to help them in the long term with organization, getting an evaluation for medication. I always think what works best for people is when they do get a psych eval, they have a prescriber along with a therapist too that they work hand in hand with. Because I'm very big with like the more support, the better, But with the services that we do provide, it's like I've seen just amazing outcomes in all aspects. I've seen amazing outcomes when somebody just gets like diagnosed with ADHD. Like it's like the most validating thing they've ever experienced because they had no idea that the symptoms they had were the cause of mental health. Whereas they thought, I thought that this was just how I was. Like, oh my God, I didn't know that this could be helped, So it's really cool to see just a variety of really positive results with something that's so stigmatized as mental health when really it's like it shouldn't be like that. Like we need to look at it as just as important as like your physical health pretty much. Like oh my God, your gym goals, it should be like what about your brain goals, like that's a part of your body too.
I love that.
Thank you.
Brain goals.
Yeah,
That's
brain goals.
Brain goals. How did you even get into this? Like, how did you get into this role? A background about you? What kind of prompted you to get into this industry?
So I have horrendous ADHD, and I was diagnosed super, super young at like 6. It runs in my family on my mom's side. It was never really talked about. Like the family I grew up in, we really didn't talk about mental health. Nothing like that. So I was diagnosed at 6 and put on medication very, very young. It was never explained to me what ADHD was. like nobody really told me about it. So as I got older, I basically like medicated myself with alcohol, and I drank like very, very heavily from high school all the way to like my early 20s until it got like very out of control to the point of like physical dependency. And even like after treatment and things like that, and like stopping drinking, for years of my life, I still did not know what ADHD was. Like, it's still like, I just know I have it, you know, I don't really know what it is. So, I got into working in the addictions field in 2014. And I'm like, yeah, this is what I want to do. Like, I want to help people. Like, I was always very driven to do it. Like, very easily pick up on people's emotions and want to be able to like help support people through their pain or what they're experiencing. So I started in that field in 2014, and I met my now boss at the place I was working. That was in 2000, I think 15, and we've been friends ever since. She left there in 2018 to open her own practice, and I was like, I want to come with you. Like, I believe in what you do. She's a nurse practitioner, and she was like, just take your license exam. And of course, I put it off for like, I think, yeah, it was like 2.5, 3 years after that. I took it and quit my job the next day. I went over to her 2 weeks later in 2021. So I wanted to work from a more mental health basis when I started to learn more about my own mental health and realize like how validating it is to learn about kind of like what goes on in your head. And for me, when ADHD was explained to me as like the nonstop chatter in your head, because I look at it like I'm pretty introverted. I'm a homebody. Like, I'm not like a wild kid anymore. So I'm told, like, oh, yeah, you grew out of a lot of your ADHD. And it's like, no, I didn't. It internalized itself, and it was going on like up here where I could sit and stare at a wall for like hours, like actively thinking about what I need to do, but like I'm unable to do it. I'm forgetting things all the time. Like, I can't do my job correctly. Like, no matter how much I try, everything feels like it's just not working. And when I learned that that was ADHD and I wasn't just a low functioning human, it just felt very validating, because then I was able to start working on it, and it really made me want to work with the population of people who struggle with ADHD as well, because a lot of people don't realize that that's what they're experiencing. And I'm seeing like a lot of adults get diagnosed with it now because they had no idea that these things that are making their life difficult to live, it's not them, it's their mental health, you know, and people need to know that, you know, and they need to get the treatment for it, whether it's through medication or through like talk therapy. It's something that people need help with, because it gets very depressing when, you know, you can't function like you think you should, you know.
Wow. I mean, that's a truly inspiring story about where you were and how you're able now to help so many other people based on your own experience. And I think that that says a lot about your character, because uh, you know what pulls you to do this, what draws you to do this. It's, you know, I've experienced it, and I want to be able to help. And that is something that is so incredibly inspiring, and really places you to be beneficial to the people that are suffering from these mental health disorders like ADD and ADHD, or anything else that you guys are able to treat over at Lower Bucks Wellness. And wow, I mean, it's really inspiring to me, because it sounds like your personal philosophy is very much similar to Lower Bucks Wellness philosophy. And what I'm hearing is we just want to help. We just want to be a resource for the community to be able to go to whenever they need. And even by opening up this mental health urgent care, which is the first of its kind, first that I've ever heard about it anywhere. And now I'm going to be a huge advocate for this, because I didn't even know it was a thing. I really think that says a lot about you and the company that you work for.
Thank you. Well, yeah, a lot of places, you know, you hear about people saying like, "Oh God, I can't get an appointment anywhere," and things like that, and it's hard. So, with us, we want to try to make it so people do have access and they're able to be seen. But yeah, with lower box wellness as a whole, I mean, besides ADHD, we treat like a variety of things. I have like my postcard as reference, but where ADHD, so it's hard for me to organize my thoughts. But like we do treat, major depressive disorder, bipolar, anxiety disorders, obsessive compulsive disorder, post traumatic stress disorder, eating disorders, psychotic disorders. Like
Wow.
you say mental health, like we're there's a lot of mental health disorders out there, but when individuals call for an appointment or if they email in for an appointment, what they do is in the beginning, we email and text them directly from our system paperwork that they fill out for intake. And then they just click send, it comes right back to us. We get a notification, look it over, and approve it within 24 to 48 hours that they're appropriate for the level of care that we offer. So we always make sure that if somebody does want to get treatment from us, that they'll actually like be able to. It's not like oh yeah, like we're gonna turn you away when you get here. Like no, we have like a process where it's like before you even start, like we wouldn't be aware that this is something you will absolutely benefit from first.
Would you say your favorite part of the job is like seeing people come in and then they go through some treatment, or whether it's talk therapy or medically assisted therapy, whatever it is, and then like the light kind of go on in their eye, like oh my goodness, it's all starting to click now. Um, would you say that's your favorite role, or is there something else that also really kind of plays a part in why you stick around so long?
I think all of it, to be honest with you. I mean, the only thing that I hate about the job is like during virtual sessions if like Zoom goes down. Like
Mm,
that's
yeah,
that's
the
literally
technical difficulties.
yes, which I can't stand. Don't get me started on when Instagram goes down. And I'm like literally on the lower buck social media posting a reel,
Hmm.
losing my mind. But no, like to be totally honest, like I love every part of the job. And for me, I make sure like I do practice self care on my downtime because, like, in this field, it is very easy to burn out when you're helping people that are struggling. But the thing is like, I preach self care on a daily basis to my clients, regardless of what their diagnosis is, about like ways they could take care of themselves, you know, in regards to like what they're going through. Because I don't really have a plan before sessions. Like I just meet them where they're at and kind of intuitively work with them regarding like, hey, what? Let's try this as homework this week. I'm a homework giver because I'm like, no, I want you to get better and do stuff on your own time too. But to watch people like learn to take care of themselves in a way that they've never done before is so cool, because it's like you're literally watching them kind of like, I guess you could say, like become free from something that they might have not even known that they were struggling with before. And like I know how that feels, and to watch people be proud of themselves is like really friggin' cool. Like just because it's like you're talking to people who might have never had that chance before because of whatever experience they've been through in their life. So for me to be able to like be there as like a witness and a support to their experience is huge. And then the other aspect of my job of just getting like people to know about what we do, and to let them know like, hey, not all psychiatrists are like older men, or people who just like write you a script and send you on your way and don't get to know you. Like the majority of people that we work with are young, they're women, they're very savvy, and they want to know you. And from what I hear from other people, that's something that like really sticks out to them about like what we do is that like, oh, you really care. And not to say that other people don't, because there are other people that do, but to hear that other people could see that we do care is great, because we actually do. And with the field of mental health being very stigmatized, mental health itself being very stigmatized, I want to show up every day knowing that I'm doing what I can to kind of like break that stigma and show people like this is not like an in and out type thing. Like this is a like we want to get you better, you know, and just to verify again, like I'm sure other people are like that as well, but a lot of people like haven't experienced it when it comes to mental health because of how stigmatized it is in like the public eye or whatever. You know, it's getting better, but we've got like such a long way to go with acceptance and publicly talking about like being on medication, going to therapy, things like that, you know.
And I think it's incredible what you do, because you come from that language of the heart where it's like, I've experienced it. How can I best assist you with what I've experienced in my journey, and not just regurgitate some stuff out of a textbook that I learned 10 years ago.
Yeah.
So.
I've had a lot of really, can I curse here or no?
Yeah, I mean, that's fine.
Okay. It's just, I already asked, so I'll avoid it. But like, I've had like really bad therapists throughout my life, like starting as young as age like 5, you know, and then diagnosed with ADHD at age 6. And my parents really based it off of like who's got the fancy degree on the wall. And then they're sending their like young female child to like these grown men to talk to. One was an older woman, and she just made me play like Connect 4. I really couldn't stand her at a young age. But I was resistant to anything that was suggested to me from probably age like 5 to like 23, you know? So it's like.
And that's a long time to suffer.
I was very like, doing it my way, you know? But I will say, like, there wasn't therapists when I was younger that like I connected to at all, you know? And from talking to clients on my own, it's a thing a lot of people go through. And I always tell people, like, shop around for the right provider. Like, please do not go to one appointment and be like, I don't like them, I am never doing this again. Like, please shop around. It's like, you know, when you're in your first relationship and it doesn't work out, like, you don't stay single for the rest of your life. Like, I mean, some people do, but I'm just saying in general, like, you date, you meet somebody new, you know, whatever happens, happens. But it's the same thing with when it comes to mental health providers, because I've heard horror stories about therapists from people, like, besides myself. And I'm like, it makes people not want to do it, when really it's like, no, please shop around. Like, I tell people, like, when I used to take new clients, like, hey, like, if you don't feel like I'm helping you, please let me know. Like, I will help connect you with somebody else, you know? Like, I don't want you to stop seeking help just because you feel like the individual you're meeting with isn't helping you, you know?
Yeah, I think that's important, because it really just comes from like, if this isn't the right fit, like, I completely understand. I just want you to get the help that you need. And I do the same thing too with my own real estate business, right? Sometimes it's not a good business decision for me to take a particular listing. They want it to be priced way too high. I'm just like, I'm not getting that number. How can I market the property with that number in mind? And it just might not be a good business decision. I'd rather disappoint you now, tell you that your house isn't worth as much, than have to come back in 6 months for a price reduction, and you know, and then nobody's happy, you know. So I completely understand where you're coming from, where we just want to help.
Yeah, we just want what's best for the other person.
Exactly. And if we're unable to, there's no ego involved, I'm happy to pass it off to somebody else that might be better suited for you.
Yeah. I just want humans to like be okay,
yeah.
you know?
Yeah.
Because a lot of us aren't. And it's, you know, it's heartbreaking to see. And especially with mental health, like, people suffering in silence. They don't want to speak up. They think it's just going to go away. It'll get better on its own. Let me distract myself with something external. And it's one of those things that it doesn't have to be that way, you know?
You're absolutely right. Wow. Well, next I like to move into a segment called the Big Three. So the Big Three are 3 questions that I ask everybody that comes onto the podcast. So Zoe, my first question for you is, what do you think makes Bucks County a great place to live?
Well, coming from someone who lives in Northeast Philadelphia, I could think of a variety of reasons why Bucks County is a great
Why is
place to
everybody
live.
stinking on Philly? It's so funny because you're not the first person that said that, and you're
Really?
not, and it's a shame. Like, I'm a Northeast Philly kid, but now I live the Bucks County dream, and
Yeah.
I love it here.
It's funny because my family is like originally from Northeast. I grew up like out like in Montgomery County section. So like I didn't grow up in the Northeast. I have been living there for like 10 years though.
Hmm.
So I am like the last of my family that remains in the Northeast. It was like the older generations from there.
Hmm.
And so I will start off by saying I am very grateful for where I live. Like I have a driveway. Like when I moved out of like the north-ish section, like I cannot tell you having a driveway, life changing.
Makes
But
all
like,
the difference in the world.
oh my God, it's amazing. But like, I'm ADHD going off topic. Bucks County, Bucks County. So personally for me, like I love the woods. I love farms. Like my goal is I want to buy a farm. I want a property up with at least like 2 acres. I'm being very picky, maybe a little unreasonable. I don't care, but I love that Bucks County is full of a lot of land, and it's like a lot of the land. There's historic parts. I love taking my dog up to Lake Alina, Peace Valley. I just started doing it a few weeks ago and like fell in love with it up there. I've heard that there's alien sightings, which makes me love it even more. But I usually go when it's like night and it's quiet, and it's probably where I recently got poison ivy, but I'm totally okay with it. But that's like for living in Bucks, like 100% like that just the outdoors aspect of it. I'm a big fan of Upper Bucks County.
Yeah, it's beautiful up there.
Oh, I'm
It
obsessed.
really is.
And it's like honestly affordable compared to like other areas that are suburban Philadelphia.
Yeah.
And I think it's a lot nicer. Sorry, Montgomery County, where I grew up, but like it's. And I will say, like the people, I like the people. I do like the people I met, like really down to earth, like good people. I'm a big Bucks County person, and I used to be like gung ho on city living, and then I guess like my 30s are all nope, but not anymore.
Yeah.
So yeah.
It's interesting, as we grow up, our priorities start to change, and we start to experience some different things, and
Calm down a little.
yeah, I feel the same way, where I was very much a city kid, and now I'm living out in the suburbs, and I couldn't imagine it any other way.
Oh,
So
I love the suburbs.
what are some of your favorite restaurants in Bucks County?
I was thinking about this, like, and I was talking about it with Dina, the owner, and I'm thinking like, dude, like I love Taco Bell, like,
We got a couple of those around here.
but then I'm like, what? Like, wow, lack of effort on my part, And where I love Jules Pizza, I literally had a piece before I left the office just now. Nourish by Mama is so good in Doylestown.
Mm.
Like it's all fresh food. I'm pretty sure it's vegan. I mean, I eat meat, but when I order from there, there's not meat in my food, so I'm guessing it's vegan. But I like Ardana's a lot too in Warrington. The Hattery is really good. I'm a food person. I don't like eat big meals. I'm more of like let me eat like 50 things throughout the day. But like, yeah, highly recommend those. If you're in Doylestown, go to Nourished. It's so good.
Awesome. And my last question for you, Zoe, is where can people find out more about you and Lower Bucks Wellness?
Definitely Instagram. I would say my personal one's easy. It's just my name, just Zoe, and then Elizabeth Alloy. That's it. Lower Bucks Wellness Instagram is just Lower Bucks Wellness, one word. We post announcements on there, updates, things about staff, things about groups, new services. Yeah, so definitely Instagram. And we are also in the process of updating it so we can have like an email list for people too, so they can have access to information like pretty quick.
Awesome.
Yeah.
Well, thank you so much for coming out today, Zoe. I'm really excited to see how Lower Bucks continues to grow and just help a ton of people in the community, and especially keeping their doors open as a mental health urgent care wing. I think that's absolutely incredible, and your why as to why you continue to show up to work every day is truly inspiring, and you are inspiring. So thank you so much for sharing all of your stuff with us today.
Thank you for having me.
Thank you. And as always, I'm your host, Alex Neff. Make sure to reach out if you have any questions about Bucks County living.